Barbara Birx is a response coordinator for the White House Coronavirus Task Force, and she joins us now from Washington. Dr. Birx, thank you for taking the time. I know your plate is overflowing, but I want to refer to Wei Zhang's piece where we heard the president say, we are going to win and we will win very quickly. What is the White House definition of quickly?
I think we're all looking very closely at the data coming out of China, the data coming out of South Korea. We're encouraged by the recent reports from China of no new cases. We're watching very carefully about China going back to work and seeing if that impacts the spread of the virus. So we're learning from other countries. If our profile looks like China, we believe that that is very quickly, but we're evaluating every single country and the data coming from that country.
Dr. Birx, I think Americans can handle just about anything, but they do need to know what to expect. You mentioned China as a possible timeline. Right now, we're in this 2 weeks to slow the spread period, but there are other reports coming from the administration about a possible 18-month fight. How long should Americans be prepared to take precautions to fight this pandemic?
You know, that's a great question. The models not only looked at what's happening during this current outbreak, but you know, with respiratory diseases, they have a peak and often fall off during the summer months, if this works like every other respiratory disease that comes to us in the winter. Then we're tracking very carefully about what would happen if it came back in the fall or came back in the fall after that. And that's why the president's been working nonstop, both on therapeutics that could be available in the summer and fall, and vaccines that could be available in the fall of 2020. So it's just a today vision, a tomorrow vision, but also a 90-day vision, a fall vision, and a fall 2021 vision to make sure that we're following everything.
At this point, when do you anticipate the peak to be?
Well, the only thing we can look at is the same thing you all are looking at, is what the peaks look like in every other country. Now, in every other country where the peak came and the cases declined, it was because every single person in that country followed the guidelines that our president has put out. These guidelines are extraordinarily important. It's about social distancing. It's about washing your hands. It's about ensuring that you're protecting yourself and protecting others. It's not about partying on beaches during spring break.
So, Dr. Birx, what concerns you most at this point?
I think the rapidness of getting our own data, I think that's very important. We applaud the legislation for putting in the White House request for reporting. I think we need to see 100% of the cases. I know a lot of people are looking at the data that came out of the MMWR this morning. The numbers are not large enough for us to make conclusions from. But as we've always been worried about individuals with pre-existing conditions in every age group. So we're asking every hospital, every clinic to report both their testing results and their outcomes at the hospitalization.
Can you give us an update on the testing? How many cases are out there? How many more do you need? When you take the test, how long does it take to get the results? People are very concerned about the testing.
That's an excellent question, because what happened with the testing before we could get the high-speed laboratory commercial labs up and running is there was a backlog. And so to every Americans out there that's watching the new cases, these are new cases coming from the backlog for samples that were collected 4, 5, and 6 days ago. And as those get run, our number of new cases will dramatically increase because they're not daily cases, they're cases that are from the last few days. Once we get through the backlog, we'll be able to tell you precisely how many tests are negative, how many are positive, and with this new reporting requirement, it will be accurate.
Dr. Birx, thank you very much. We appreciate you being